Hi guys, my name is Justin Day and I'm a coach with 7 Elite Academy, and I've been coaching youth soccer for about 8 or 9 years now. And outside of 7 Elite, I'm the founder and Chief Medical Officer of Vive Adolescent Care in St. George, Utah. Vive is a hospital and treatment center for youth struggling with mental health concerns like depression, anxiety, trauma, and those struggling with the contemplation of suicide and self-harm. And, our age range is about, 12 to 17, but we've had as young as 9 years old. And, we want to come together with 7 Elite Academy and really spread awareness for not only mental health, but also suicide prevention, and really just get the word out there. Suicide is the number two leading cause of death in ages 10 to 24, and it's only getting worse. And so really 7 Elite, we wanted to bring awareness of this and really try and change and turn this around, and anything we could do to help the community of St. George and out elsewhere. So, more teens die from suicide than, like heart disease, cancer, AIDS, birth defects, strokes, pneumonia, other lung disorders, and flu, COVID, everything combined. So it's a really big problem, and most of them actually show a lot of signs. So about 4 out of 5 will show signs either verbally or behaviorally before they follow through. And so we really want, because coaches have a huge role, right? Coaches can really make a huge impact, and we have the special opportunity working with the youth and with their families on recognizing some of these concerns. And so I wanted to kind of just help you guys know what to do and how we can help. So, you most likely always will have someone on your team struggling with some sort of mental health. It may be a little minor, right? But there's always going to be something going on, and so we need to be keen to these struggles as well. So if you notice some things like, kids talking about, either death or feeling empty, hopeless, you can have them feel almost like an extreme happiness at once, giving stuff away, giving shoes or writing notes and giving them goodbye letters, and aggressive behaviors, changes in agitation, or more isolated and withdrawing from their peers and less engaged emotionally. Those are typically your signs that are often overlooked. And so if you're seeing some of those signs, we want you to talk to your players and really, bring them in and just ask them what's going on. Are you struggling with something? How can I help you? But also making sure we're involving families, to say, I've noticed these things, and, I'm a little concerned. I'll keep an eye, but, is there something going on at home? How can I help? That'll go a long ways, really, because it alerts parents to other things maybe they're not seeing, right? And a lot of times it's really subtle.